We're good.
Take it away.
All right. Hello. My name is Forrester Pack, the four-star troubadour. He is Alexi Landretti.
Hello.
And we are part of Your Healthcare Future, broadcast on WFNU 94.1 and on our HCAM website, hca.mn.org. Your Healthcare Future today, we're excited. We have an all-star panel. We're going to be talking about the issues with insulin and the prices and so much more. So we just want to go around and introduce everyone for our viewers and listeners today. If you could just say your name.
Sure. I'm Leah Greenside. I'm from St. Paul. My daughter has type 1 diabetes, and I'm an advocate with Minnesota Insulin for All.
And I'm Deb Souther. I live in St. Paul, and I've been a type 1 diabetic for 46 years.
I'm Katie Scott. I live in Minneapolis, and I've been diabetic for 2 years.
My name is Lindsay Helgeson. I am type 1 diabetic as of 8 years. I live in Minneapolis.
All right. Thank you all for sitting down with us today. We're ready to learn more. And if we could begin with you, Leah, could you describe to our listeners the experiences and struggles that your teenage child with type 1 diabetes faces?
Well, sure. Type 1 diabetes is an autoimmune condition in which the pancreas no longer produces insulin, and we have to try to supplement it by using insulin, which is very tricky to do. It's a chronic condition. It requires 24/7 management. My daughter uses an insulin pump, which is giving her insulin all day long, and then she has to count the number of carbohydrates in her food and use her pump to give her more insulin. Unfortunately, it's a bit of a guessing game, so frequently her blood sugar is either too high or too low, which we need to try to avoid at all costs. But it's a very tricky disease. It's a very time-intensive disease, and unfortunately, it's also a very expensive disease to manage.
The infrastructure around it is our nation's healthcare system. And we wanted to know if there were particular episodes of medical hardship that were compounded by our current healthcare system, and if so, how so?
Yes, well, my husband and I are independent consultants. We have a small business, and so we get our insurance through MNsure, through the Minnesota marketplace, like an Affordable Care Act plan. And we've often been on high deductible plans as a family. And so that really compounds the problems around affordability of insulin. So we've paid close to the list price for insulin with some frequency, which could be as much as $700 a month for my daughter. So that is really a struggle for us. So like you're saying, in terms of the healthcare system, the problem with these high deductible plans compounded with a very high list cost for the drug together make it very unaffordable for many families. We've also struggled with other kinds of issues, like just getting the type of insulin that she needs. It's not always on the formulary of the insurance plan, and we need to fight with the insurance company to get that covered. We've had problems with other sorts of supplies, that just ordering them and getting them regularly sent to us, and the cost, we struggle with it all the time, unfortunately, as I'm sure others do as well.
So would you say as a small business owner, it's definitely hard on you?
It's very hard. It's both hard in terms of the overall cost.
Mm-hmm.
Last year, my family spent $27,000 on healthcare.
Mm-hmm.
So as you can imagine, as a small business, that's a substantial portion of our profits. And additionally, it's just the amount of time that it takes to navigate the system. In January, for example, I went to refill my daughter's insulin, and it took me 11 days and 15 phone calls just to get her insulin refilled. It was the same insurance company, the same insulin that she's been using for years, just a change in plan year, and it caused multiple problems that wouldn't be resolved took over a week and a half before we could actually pick up the insulin.
It's wild. So last spring, you and other citizens took it upon yourself to organize a caravan to Canada to purchase lower-cost insulin for your child. The caravan departed here in the Twin Cities and headed for Ontario. Could you describe how this idea formulated?
Sure. It actually came up. I was talking to a BBC reporter about other travels that I had done buying insulin, and she and I were talking, and I said, I can organize some other people to go up to Canada and buy insulin if you're interested. And she said, yeah, I'll fly out from LA and join you. So we ended up having 6 people. We all drove in a caravan, like literally cars after each other, along with 3 reporters. We went up to Fort Frances, Ontario, which is about 5 hours from the Twin Cities. And we so we left on a Saturday morning. We drove all day. We got up there in the afternoon, and then the actual purchasing of insulin in the pharmacy in Canada was like a non-event. I mean, we walked in. We had called ahead to make sure they had sufficient supplies in hand. So we talked to the pharmacist. We bought our insulin. We walked out. Very easy. We ended up as a group spending about, I'm going to make sure I get this right, but it was just a little over, I believe, $1,000 for all of us, which would have been $10,000 of insulin. I know it was 10 times. I don't remember
That's
now
crazy.
exactly how much, but it's 10 times more expensive in the U.S. than what we had paid for it in Canada.
And again, how many people were on this caravan?
Yeah, this first trip, there were 6 of us who were actually buying insulin, along with some reporters. And I'll say, actually, the funny thing was we were very worried about going back across the border as well.
Oh, my gosh.
Because we weren't quite sure about whether the Border Patrol was going to, ask us to see the insulin or ask us questions. But it was so easy. They asked the purpose of our trip to Canada. We said we were there to buy insulin. The guy immediately went on and said, "Do you have any alcohol, tobacco, or firearms?" We said no, answered a couple more questions, and we were on our way. So all in all, it was a very simple thing to do to be able to buy it abroad.
Wow.
Easier than and much less expensive than buying it in the United States.
In fact, the idea of having it have to come to that point. We have a chart here that we're looking at, consumer good prices from 1996 to 2017, and insulin went up 1,200%. In the last 20 years. So that just proves like how it got to that point and having to do this.
Yeah.
So
now we're going to kick to Deb.
Yeah. So would you say that our current healthcare system has created hardships for you in similar ways than it has for Leia and her daughter? How so?
Oh yeah, definitely. We also are on a high deductible health plan. And so the first several months of the year, I mean, we're paying full price for insulin. So that means you really have to rearrange your finances and try and, get all that figured out. And just even in the last several years, I mean, trying to put our kids through college and all that kind of things, all of that stuff, all the expenses with that. It's a real juggling act. I mean, I drive an old dented up van and a rusty van, and my husband makes pretty good money.
Yeah.
But it's just because of the healthcare expenses that it's caused a problem. My husband did end up changing jobs this year, which was very difficult because now we're on another health plan, and so we've got a second deductible to
worry about
to meet this year. So that's 2 in 1 year. So we basically had to save up in order for him to change jobs.
That's ridiculous. Yeah.
And Deb, with one caravan being enough, they have to do another caravan.
Yes.
2 caravans
yes.
because of how out of whack our current system is in the United States. Could you talk about this second caravan experience? How it came about your joining?
Right. And actually, before that second caravan, my husband and I had been up in northern Minnesota, and I was running very low on insulin. And so it's like, okay, we're going to go up to Canada and buy just this one bottle to tide us over. And it was amazing. I mean, we just went across the border. I walked into a pharmacy. I said, I want 1 bottle of insulin. They gave it to me. They sold it to me for. At that pharmacy it cost me $40, and the normal insulin that I take is $400 a bottle.
Oh wow!
And I was just like, it was like I walked out of there just like giggling. It was just funny. And then that was in early June, and then later on in June, I went with the caravan, and we had people from Minnesota, from Wisconsin, and Michigan, and Ohio that joined us on that caravan. And we actually took a bus and several media, and part of the reason for that trip, besides, I mean, obviously buying insulin and getting our supplies, or getting our insulin supplied, was to create awareness.
Of course.
And as we talked to people along the way, many people just weren't aware of the plight of diabetics and the high cost of insulin, and so
What was kind of the group feeling? Was there like fear as you were crossing the border to do this?
There
Was
was-
excitement? Like, how did you?
All those emotions,
Yes.
all of them. I mean, they led the way with their caravan, so we knew that, it could be done. But there was still some trepidation, and, as we got to the border, and it's like, okay, I've got my passport, I have this. We're telling them that we're going to buy insulin. Are they going to let us through? Did we just drive for 12 hours, sit 12 hours on a bus for nothing? And it was late at night when we crossed into Canada. And so there was some of that fear, but there was also excitement, and so we went and we stayed that night, and then we got up the next morning, and there was some difficulty with the pharmacies. The first pharmacy was afraid of the backlash from their suppliers if this was displayed on media. And so they decided that they weren't going to sell us insulin. And we were able to find another pharmacy then that was able to sell us insulin. They did not want to be recorded, but they sold us insulin. We ended up going to a Walmart pharmacy. We would have rather gone to a local local pharmacy, but local Canadian pharmacy. But we went to a Walmart pharmacy, and we were able to get the insulin, and just people's faces as we were walking out of the store and cheering and just all excited and so. But
And I know right now so many listeners and viewers out there are thinking who have maybe diabetes or know someone who has diabetes dealing with it and thinking, wow, it's come to this point in this
Yeah.
Right.
Well,
Yeah.
it's still worth it, isn't it? Having to go across the
It
border.
is.
It's so
It
expensive.
is. It's definitely worth it. I mean, paying $400 for a vial of insulin or paying $40 for a vial of insulin, and I use about almost 3 vials a month.
Oh wow.
So I mean, it's it's
even
nothing.
after,
It's like
it's
and
wild.
basically you can get like 3 months supply is what the
Mhm.
the government
Contract,
says
yeah.
you can. It was what the government says.
Oh,
you
yeah,
can
yeah, yeah.
transport. Because it's basically enough for your own personal use, and they figure so 3 months supply, and so it's worth it just to drive up there every. We are so fortunate where we live in the Twin Cities. We're only like 5 hours from Canada. But I think of people in other parts of the country and people even in Minnesota who don't have the availability to drive that far, to taking off work and,
And there's still an
and
incredible
gas and
time commitment to
yeah,
have to do. Yeah.
it is.
Wow. But Lindsay, so you also manage type 1 diabetes. Could you talk to us about your experience with
Rationing?
rationing? Yeah, sorry, rationing your insulin. Also, how does your insurance play a negative part?
Sure. So I've been type 1 8 years, so it's all very new to me. I actually have pretty good insurance at work. I'm really lucky that way. But it's not always consistent. When I go to the pharmacy to buy my insulin, it could be as low as $25, or they could hike the price up times 7 or 8, randomly. And I am budgeting. I have a home, I have a mortgage. Things happen with maybe with your car, or with furnace, or whatever, and suddenly I have to fork out $200 more that I wasn't expecting. I'm budgeting for 25. Everything is super, super tight. And so I've had to not take all of my insulin. I've had to let it, stretch it out.
That just sounds dangerous.
It is dangerous.
Yeah.
For so many reasons that I'm learning that I had no idea when I first was diagnosed. But, first of all, having higher blood sugar, it affects the way you think.
Of course.
Clearly. So here I am working at my job, trying to do the best that I can, but I'm having to ration my insulin. I'm having to stretch it out so it will last longer so I can afford it, but yet I'm trying to do the best I can at my job so I make more money so I can afford this insulin. And in the beginning, it was really difficult. It totally affected my thinking and to a place where my salary was cut like in half. So here I have all these hospital bills suddenly and these doctor bills you're supposed to follow up with. And this, all of a sudden the supplies for insulin and just to test your blood sugar up to 6 or 10 times a day. That's an immediate, $1,200 to I think it was $1,800. And then you're trying to coordinate everything and count out your carbohydrates and take the insulin and you've got this confusion going on in your head. It's almost like it's so hard to focus when you have this high blood sugar and then your salary is cut and then you have to pay for this plus all the other things. You get behind very quickly.
Well, thank you so much for sharing.
Yes.
I understand that can be very challenging. We really appreciate
Okay.
it. Don't
I
apologize.
haven't talked about it.
And that's what we're here to hear the truth of what's actually happening to actual human beings. Like, this isn't a game.
Well, not only that, so say all of a sudden your insulin is suddenly increased, right?
Yeah.
And you talk to the pharmacist, how can this be? What's going on here? Well, I've heard things such as, your doctor wrote the prescription differently this time. So that's probably why we have to charge more. And I said, no, I have the prescriptions. They're the same. Well, you're going to have to talk to your doctor. Talk to the insurance company. So then I'll call the insurance company. Back and forth between the insurance company and the pharmacist. And they're saying, well, it looks like you were prescribed, for this 3-month supply, this much, but yet now it's been several months. So it doesn't look like you're taking it at all. So I said, so what do you, because you keep charging me more every time I go, but are you saying that you didn't get enough money out of me?
So there's this vile interplay going on between not only the insurance company, but it could be the pharmacist too.
Yes.
Yeah, absolutely.
Yes.
Yep.
And there's just no response there, and they say, go back to your doctor. So I said, it sounds like because you're upset that you didn't get the full amount of money from me, and now I've stretched this out, that you want to charge me more, so it's better for you on your end. And there's no response. Call your doctor.
It's terrible. And it just sounds like the bureaucracy behind the entire system is just completely out of whack.
Yes.
It's complicated and unnecessary from all your stories so far.
And draining. It just appears.
Yeah.
It is.
Draining.
It's pretty heavy.
And we've talked about it from our perspective as patients or parents. But doctors also struggle, and if you talk to doctors who work in endocrinology units, they spend a lot of their time just struggling to try to get what they think is the best treatment for their patients, rather than actually spending that time working with them. So that's a big waste as well when, the system has become so complicated that doctors are now spending more time administrating benefits and arguing with insurance
Then they are
than
treating
they
the
are.
patients.
Yeah. It's true.
So every stakeholder is affected by this, and
Yes.
it really
Yes.
needs to change. Katie, you were diagnosed with diabetes 2 years ago, if I'm correct. Could you talk a little bit about your experience?
It's been a really wild experience, honestly. You're 22, and you kind of hear all these, I wouldn't call them myths, but people typically think that it's passed down in your family. No one in my family has it, and you get it when you're really young. That wasn't the case for me. I was obviously 22. I was living on my own. I was trying to start my life. I was already living from paycheck to paycheck because I don't know what 22-year-old doesn't,
Yeah.
So you're really trying to get yourself together and better yourself, and getting diagnosed is taking 1,000 steps backwards. It's what do you prioritize at that point? Do you prioritize school or getting a job, or do you prioritize the diabetes?
Yeah.
Obviously the diabetes, but at the same time, being 22, you're not a child anymore. You can't just call your parents. I am still on my parents' insurance. That is good insurance. I'm only going to be on it for about another year and a half. And I'm a small business owner as well too. So hearing a little bit about your story kind of freaks me out for the future. The future is super unknown to me, which is just wild. But going back to the fact that I'm still on my parents' insurance, and I'm still living paycheck to paycheck. I can't call my parents up every single time I need insulin. I'm an adult. So there's definitely been times where I've had to choose between basic human needs. Am I going to fill up my gas tank, or am I going to buy myself this bottle of insulin? Am I going to, or there's even been points where, am I going to buy test strips, or am I going to buy long-acting insulin, or just my mealtime insulin? I have to choose between one. And they all are necessary
Well, of
for me to
course.
function, you know?
Yeah.
So it's just been an extremely hard time, and like finding that support system and being so young and not having people that are type 1 that you surround yourself with. It's a very, very lonely journey, and the stress with it, it's just really something that is hard to explain, you know? So, yeah, it's been... Were you going to say something?
I was just to say, there's even the stress. It's like, what if I drop my vial of insulin and it
Oh my
breaks?
God.
What if, you know?
Yeah.
Yeah.
Even if I have the money to pay for it, the insurance will come back and say, well, we've already filled your 3 vials this month.
Yep.
You know, and so it's a big fight
Yeah.
to get more and stuff. And,
Totally. And I've even gone to the pharmacy some days to refill my prescription, and they'll say, oh, we're out of that, so you have to come back tomorrow.
Yes,
Oh,
that's happened many
It's-
times.
Run out,
Yeah,
yeah.
I don't think people understand that you will die without it.
Yeah, right.
It's not a choice. Like, I can't just not take insulin today. Like, okay, then I just won't eat then.
Yeah, right.
You know what I mean?
Yeah.
So it's just, I really don't, I think there also is not a lot of education on it.
Yeah,
Where,
yeah.
like, even being diagnosed myself, thinking of all of the stereotypes of it
Mm-hmm.
and learning myself about it, where I think and also another thing, when I would tell people I was diabetic, they go, oh, I thought you had a healthy lifestyle.
What?
Yes.
You know, like, I thought you were, because I'm a yoga instructor, I own my own yoga studio,
Oh, wow.
like, whatever. But then, but yeah, people would be like, oh, you're diabetic? What? Like, what? And I'd have to explain this entire whole different side of it. So there's weird, I don't know, there's just like a whole weird side to it that people, there's total shame, yeah.
There is.
Yeah, and
speaking out.
I didn't realize how ignorant some people can be too about it. So it's been,
I think part of what I really like about this movement here in Minnesota is that it's starting to break through the shame about having diabetes, but also the shame around not being able to afford your health care. So
Right.
I am not a failure as a parent because it's so expensive, to get my kids what she needs. That is a failure of our system. It's a failure of our elected officials not to fix this. It's not my fault. It's not your fault. It's none of our faults that we're struggling like we are. And the more of us who speak out about this, the more we break down that shame and we can use our voices to say this must change.
Of course.
And we've discussed Canada at some length. What are other countries doing to keep insulin at a reasonable price?
Yeah, I can talk about that. I've traveled around the country and I've bought insulin in 6 countries, 6 developed countries. At all of them have been about 1/10 to 1/18 the cost of what I've paid here in St.
Wow.
Paul. So the same box of insulin pens that I've paid as much as $700 in St. Paul, I've bought from between $40 and $70 in other countries. There's a couple of things going on. Most of the other countries, many of them have a single payer system in which the government is able to negotiate the price of the drugs, and so they are lower. Other countries, even that have a different type of system, they are able to negotiate the rates and the costs of prescription drugs, and they say you're not allowed to charge more than this amount. In the United States, Medicare and Medicaid, who would be the largest group that would be able to have that sort of bargaining power, is actually legislatively banned from negotiating prescription drug costs. So we don't have that ability, and our insurance companies are too small to actually bargain with the prescription drug manufacturers in order to demand lower costs. So that's part of the big difference and why it's more expensive here.
Definitely.
Yeah, there's more government regulation in other places, much more than there is in the U.S. And in the U.S., there's some people who don't like government regulation. We also don't have a free market system. We don't have the choice of buying insulin. If it's too expensive, we can't just say, "Oh, we're not going to buy it."
Yeah.
we,
Right.
we have no boycott power.
Right. So we're what's called captive consumers. We have to purchase this at
Yeah,
any
yeah.
price, otherwise, we or our children die. We also have there's no bargaining power because there's only 2 or 3 companies that actually manufacture insulin, and they've been raising their prices together in lockstep now for a long time. The way the system works, everybody except consumers, except patients, benefit as the price goes up, even the insurance companies, because they get part of that price back to them in the form of rebates. So the insurance companies, the pharmacy benefit managers, and the pharmaceutical companies all together are benefiting as prices rise to the detriment of patients.
So there's just a massive monopoly on the healthcare system right now.
In the insulin market, it really is dominated by just 3 companies, and there's no generic type of insulin because of the type of product it is. It's a biological product as opposed to a medication. So there's no generic that would help to bring the price down, and so the companies continue to increase the prices.
Yeah. So for all the stakeholders involved that you mentioned, there's an incentive for the prices to go up because those stakeholders will certainly benefit from it.
Correct.
And we have a question here that's a bit of a supplement to the previous question. Do you believe that the only issue with the healthcare system currently is high drug prices, or do you believe we need systemic healthcare reform? And you kind of alluded to this about the other countries that you visited. They have different forms of how healthcare is delivered, single payer. What kind of system reforms would you be in favor of? And this is open to anyone and everyone.
There's a difficulty not only in the cost of the insulin, but also as Leah talked about, the supplies, things like that. But also it is very difficult to find the care we need, even in Minnesota where we have a lot of endocrinologists. My endocrinologist will tell me, well, I'd like to see you again in 3 months, but I can't get an appointment for another 6 or 7 months because they're full. So there's that. There's that too. So it's not just the cost of insulin. There's a whole wide range of things that.
Is there a shortage of medical professionals?
Yes. Yes.
It took me a year to get in with my first endocrinologist.
Oh wow.
I was getting taken care of by my primary care doctor, and she had told me that there was a shortage and she would reach out but never did, so I ended up having to, and just being diagnosed is kind of a traumatic thing.
You don't know.
It took me a long time to take matters into my own hands and get the help that I needed. So I didn't see an endocrinologist well over a year, and it took a long time to get in to be seen.
Wow.
Well, are there any other systemic changes you'd like to see?
Honestly, this is so new to me.
Oh, of course.
I was perfectly healthy before this happened. 20/20 vision, low cholesterol. I ran. I was taking supplements, and so I didn't really need to see the doctor at all. I didn't have any expenses for other medications, so this was a total shock. And so I'm just starting to dig in and realize that this is huge for so many people.
And this
not
is
just me.
This is why this is so beneficial, again, having all 4 of you here, because we're all learning together.
Right.
We're experiencing this together.
This is what they do. I have a couple of different chronic conditions, and the way our health system is now, it's like this part of me is over here, this part of me is over here, this part of me is over here. There's not a real good system for managing them all together, and they do all greatly affect each other.
Yes.
And I don't know what the answer to that is, but
it's all about interplay. And that brings us to our next question. Kind of broadly, right, down at the state capitol, there was talk about a special session possibly happening for the express issue of insulin prices. Right. Of course, it's always a moving target when you're talking about the Minnesota legislature. All of us Minnesotans know that, so we don't need to really go too much into that. We don't know if the session's happening. I know there are 2 competing bills kind of up right now, but that could change too. So broadly, what would you want our state lawmakers to do to address the skyrocketing costs of insulin, maybe fix the system in some way?
Yeah, I'd be happy to talk about that.
Sure.
I testified on Monday at the Republican hearing with their new insulin plan, and I attended the DFL House hearing on Thursday. So I can say I don't see them actually as competing plans. I think they are two plans that actually complement each other really well and would provide a lot of support for Minnesotans. The DFL House plan is the emergency plan, the Alex Smith Emergency Insulin Act. It is a program that would allow someone who breaks a vial and can't afford the next one to walk into a pharmacy, receive a month's supply of insulin right away with just completing a form, and then be eligible for additional support for potentially up to 90 days. So that's a safety net program that would ensure that people don't ration and run out of insulin and suffer horrible consequences like we've seen both in the case of Alex Smith and more recently with a young man, Jesse, who died this summer. So that's one plan. The Republican Senate plan that's authored by Senator Eric Pratt. His plan is actually provides a sustained source of insulin. It would be free. You would go to your doctor after completing an eligibility form through the MNsure website, and then people who make up to 400% of the federal poverty level and don't have federal health insurance programs. So people in Minnesota who make $100,000 as a family of four would be eligible for this program. You bring your eligibility certificate to the doctor and kind of sorting out the mechanism, but you'd be able to get insulin for the whole year and then renew that yearly for the next few years. So together, I think those two plans would provide a huge both safety net, so covering the emergency component, and then also kind of as this would solve this urgent need to provide a low cost insulin for people in the state. So I strongly support both. I think they both have a lot of merit. I think there's some details that need to be sorted out, but I would really love to see them both get proposed and move forward in a special session here as soon as we can.
Yeah, definitely. So it's 100% not a polarized issue.
It is not a political issue. I've talked to many Republicans, many Democrats. I think people agree on almost everything. We agree of the problem, that it's an urgent crisis. There's agreement even on the solution, which is that the pharmaceutical companies should be part of paying for this the solution to this problem. The emergency program would be paid for by a fee assessed on the insulin companies. The Republican plan would have the insulin companies donating all of the insulin directly to doctors. So there's agreement there that the insulin companies are important in solving the problem that they've created. So really there's just a little bit of disagreement about exactly how to administer it. So we're really getting close, I think. I'm very optimistic.
And and if I could jump in real quick here, Alexi. Leah, you had mentioned that they're complementary. They would work great together.
Yes.
And that's excellent. I guess I would ask for all of you, what would you say to those who still oppose plans like this from both parties that are trying to address the problem? Like, there are still people out there who oppose any sort of regulation, bargaining, and what would you say to those people?
I'm guessing they probably haven't lived with it.
Yeah.
Yes.
Honestly, it's hard to talk about. I can't believe there are actually people like that out there where what is it benefiting them for other people not to get free insulin? What is it going to take away from their daily life? So, and it honestly kind of scares me that there's people like that out there. And I know there are some politicians saying, or a certain politician saying that we already have an affordable insulin, and it's the Walmart insulin, which is actually used for type 2 diabetics and pets. So they're saying that we can go buy a $25 Walmart insulin, just one. Noted, we need two different types of insulin to live, a long-acting and a short-term acting. This is a long-acting, I believe. And they say that if you just take that, you're fine, everything's cured. And it's
It doesn't work the same.
Doesn't
in
work the
body.
same,
No.
and that's
It
who
takes longer.
Mhm, yeah.
Yeah.
mhm.
And you have to check your blood sugar throughout the
And
day.
your
It
lows.
fluctuates for so many different reasons.
really
if you went for a
does.
walk,
Okay, so actually, because I've been diabetic for 46 years.
You've lived through Walmart insulin. Tell us what it's like.
I've lived through that type of insulin. I can tell you that when I was taking that type of insulin, I was probably hospitalized often 4 to 6 times a year.
Oh
my God.
Just because it was
Absolutely
so
not.
hard to control my diabetes with it. Some diabetics, it maybe does work for, but you have to be extremely strict as far as you eat at exactly the same amount, the same time. I mean, you're not living a normal life.
Yeah.
You have to. That's you have to eat at exactly noon and eat this much, and then and then it has to have snacks throughout the day to help keep the blood sugar level. And even with that, if I'd get sick, if I'd get a cold, if I'd get the flu, if I'd get anything like that, one time I got an ingrown toenail and I ended up in the hospital.
Oh my
Just
God.
because that insulin could not take care of controlling my blood sugar during that minor infection. You know,
Yeah.
so it's
The Great Value brand isn't going to cut it.
yeah, it's not.
Yeah.
In this day and age, and we have medical advances that we do, denying people that is criminal.
Yeah.
Dangerous,
I think that's
yeah.
an important point. Like, yes, it will keep you alive in
Yes.
most cases, although we've
Yes.
heard that there's some people who've switched
Right.
and haven't known how to use it and
Right.
have actually died. So that's very scary too. But we should demand better. You
Well,
know?
yeah.
We can do
Yes.
better. We don't
Yes.
have to settle for Walmart insulin.
Yeah.
We have programs here on the
course.
table that have been proposed that will help us to solve this, and they don't cost a lot of money. The pharmaceutical companies are the ones who are paying. So there's no reason to oppose those programs. We should move forward.
Yeah.
And find some real solutions, not just tell people to go to Walmart.
Yeah.
Definitely. Last.
Do you have any upcoming events or comments that you want to address to our listeners and viewers before we depart here?
Well, I can say that Minnesota Insulin for All is a group. It's a chapter of T1 International. So if you go to T1 International's website, you can find the Minnesota chapter and sign up to get emails and hear about upcoming events. We do have a chapter meeting on October 23rd in the evening at Southdale Library. So that would be a great place to come and to meet other people who are really passionate about this issue. We are hoping that there'll be some action still this fall potentially, and we'll be looking for people to come out and support anything that's happening with a special session or anything else. So, it's always exciting. We're really hopeful that we're moving forward here and potentially can solve some of these problems that are affecting us on a daily basis, and then we can get to the hard work of trying to make some real difference in lowering the list costs of prescription drugs and addressing all the other parts of the healthcare system that for people with diabetes makes it difficult to live as healthy a life as we should. So that's where we're moving.
I sense momentum here.
Yeah.
I hope you all feel the same way.
Totally. Absolutely.
Yes.
yes.
All right. Well, thank you again for sitting down with us today.
Yeah,
Really appreciate it.
Thank you for the opportunity to speak to you.
Thank you.
Yes, it's great.
Thank you.
Thank you.
Thanks for listening and viewing. Your Healthcare Future signing out. And we're clear.
Awesome.
Excellent.
Thanks, guys.
Good job. That was great.
You guys did very well.
You did too.